for the ventricles of the baby's brain. So I'll show first of this probe. Oops. So it started with the aqueduct. So if I just magnify the image, this is the aqueduct of Sylvius. So that's the aqueduct, and this is the cerebral peduncles, and this is the distance between the posterior border of the aqueduct of Sylvius to the inner border of the occipital bone. So that's normal. This is the lateral ventricles. So this is the fluid inside the lateral ventricles here, and this here is the cerebral cortex. So cortex fluid, and then this is the coming down. This is the cavum velum interpositum, which is just here. And then the fourth ventricle, to show you the fourth ventricle. So this is the fourth ventricle. So if I draw you generic area, this is the area of the fourth ventricle, generic trace, area trace. So the advantage of looking at the fourth ventricle in this section is that it shows you the full area of the fourth ventricle. But when you do it sagittally, you only see just a tiny section of it. And then lining the roof of the fourth ventricle is the choroid. So this here is the choroid. Yeah. And then this here is the fourth ventricle. Yeah. Is that what you meant? Yeah. So I'm happy if you're asking me, do I think that fourth ventricle looks normal? Yes, it's normal. It's important that you see here the calvarium looks normal. I'll do a very quick sweep of this baby before I finish off. So the calvarium is normal, the choroids are normal, the cavum velum is normal, the aqueduct is normal, the thalami is normal, the cortex is normal, the fourth ventricle is normal, the choroid is present, the orbits of the eyes are normal, both lenses are present, and there's no hypotelism. The retronasal triangle is normal, there's no facial clefting. And then onto the lips, that looks normal, the jaw looks normal, the head is down, the bottom is up, the stomach is on the left hand side, there's correct situs, axis, rate, rhythm, four-chamber view of heart, outward tracts, stomach, there's normal kidneys, normal cord insertion into the abdominal wall. In terms of the genitalia is XY, and in terms of the number of cord vessels, I can see that there's two arteries. The one artery is smaller than the other, so this is quite common to see in the first trimester. And I would check the cord itself to make sure that this is not me taking the wrong angle. So I come across and I confirm this finding by seeing arterial artery difference. And you can see that there's actually the one artery is smaller compared to the other. I think we have a power outage.